When people think about the dangers of sugary drinks, sodas, sweetened teas, sports drinks, and even fruit juices, they often reduce the issue to one word: obesity. It's an easy link to make. These drinks are packed with calories, contain no fiber or real nutrients, and are consumed quickly in large quantities. But the truth is, the harm goes much deeper than just extra weight gain. Even in individuals with a normal body weight, regular consumption of sugar-sweetened beverages can significantly raise the risk of cardiovascular disease through direct effects on blood lipids, inflammation, and vascular health. The first pathway of concern is how these drinks alter lipid metabolism. High intake of added sugars, particularly in the form of fructose, leads to an increase in hepatic de novo lipogenesis, meaning the liver begins converting excess sugar into fat. This process raises triglyceride levels, reduces HDL, good cholesterol, and promotes the formation of small, dense LDL particles, which are far more atherogenic than larger LDL forms. These lipid changes are well-established markers of heart disease, and they occur independent of body fat. In other words, even someone with a healthy BMI can show an atherogenic lipid profile if they consume sugary drinks frequently. Fructose is especially problematic because of how it's metabolized. Unlike glucose, which is used by nearly every cell in the body, fructose is metabolized primarily in the liver. This concentrated burden overwhelms normal processing pathways, leading to fat accumulation in the liver, non-alcoholic fatty liver disease, increased production of uric acid, which raises blood pressure, and higher levels of circulating triglycerides, all of which contribute to cardiovascular stress. But the damage doesn't stop at cholesterol. Sugar-sweetened beverages also impair endothelial function, which refers to how well the inner lining of your blood vessels responds to changes in blood flow and pressure. Within hours of consuming a high-sugar drink, studies show that endothelial dilation is reduced, meaning arteries become stiffer and less responsive. This is a red flag for early atherosclerosis, the buildup of plaques in the arteries that can lead to heart attacks and strokes. Repeated daily insults from sugar intake can cause chronic endothelial dysfunction, especially when combined with stress, high blood pressure, or smoking. Inflammation is another key player. High sugar intake increases levels of C-reactive protein, CRP, and other inflammatory cytokines. This low-grade, chronic inflammation damages the vascular lining, promotes plaque instability, and contributes to the rupture of arterial plaques, a major trigger for heart attacks. Again, these effects have been documented even in individuals who are not overweight, showing that cardiometabolic damage from sugar occurs on multiple fronts. Even more disturbing is how sugary beverages disrupt insulin sensitivity, which in turn affects how the body handles fats. Insulin resistance leads to higher circulating insulin levels, which can exacerbate lipid abnormalities and increase sympathetic nervous system activity, raising both heart rate and blood pressure. It's a cascade effect that begins with one daily soft drink and slowly unravels the balance of the cardiovascular system. This means the old argument that you can drink soda if you don't gain weight is dangerously outdated. The research is clear. Sugar damages the heart directly, regardless of what the scale says. The outward appearance of health can mask the early stages of metabolic dysfunction, especially in people who are young, active, or genetically resistant to weight gain. But beneath the surface, the biochemical damage continues, and it adds up. So, what's the takeaway? Sugary beverages should not be treated as harmless treats or neutral hydration sources. They are actively pro-inflammatory, pro-atherogenic, and metabolically disruptive, even in modest amounts. The evidence is strong enough that some cardiologists now recommend limiting them with the same urgency once reserved for trans fats and smoking. Reducing sugar-sweetened beverage consumption is one of the simplest, most impactful changes people can make to improve heart health. It doesn't require a complete lifestyle overhaul or a new diet, just a choice to swap the soda, skip the sweet tea, or replace fruit juice with water or unsweetened alternatives. Because the damage from sugar doesn't wait for the scale to move, and neither should our decisions to protect our health.